Is there a cure for follicular lymphoma?
So this is a great question, and you may get different answers from different providers. Historically, the narrative that has been pushed around is that follicular lymphoma is non-curable. Though you may argue that this statement is based on old literature and two times where only chemotherapy was available. I would say that currently, with the advent of novel agents, including immunotherapy, biological agents, targeted agents, bispecific, cellular therapy, this narrative may be changing, and in the community, we're kind of divided. Some of us believe or maybe hope that with this new agent, with longer follow-up, we may see a fraction of patients who will not relapse and that we may consider cure, but of course we need a lifetime to make this determination.
When we see patients in clinic, we see that follicular lymphoma is an incurable disease. However, the disease course is very heterogeneous between patients. Some patients can be observed lifelong and they never require any therapy. Those are specifically patients with low volume of disease. For example, patients that you do scans and you find small lymph nodes. Many times also with bone marrow involvement. But that patient is what we call advanced stage, low volume follicular lymphoma. And many of those patients can be, usually we observe, and many of them, they never require any therapy. Contrary, patients with larger, more disease burden, they usually receive different line of chemotherapies. The most common in the United States is bendamustine with rituximab or R-CHOP in some specific cases. And also some patients, they respond well to this treatment and they are able to achieve long-term remissions, long-term responses. However, most of the patients relapse needing alternating cycles of treatment with period of observation.
So that's a great question. I think we're getting closer to more cures. In patients that have what we call more advanced stage disease, we'll probably talk about that later. We generally think that follicular lymphoma is something that at some point is going to come back, in some way. The kind of flip side of that is many cases of follicular lymphoma actually don't really need any treatment at all and can be observed for years and sometimes decades without really causing a problem with the patient in terms of symptoms or function of their organs inside or their longevity. There are a couple of particular scenarios where I think follicular lymphoma, we think about cures. One is if a diagnosis that's very localized, say one lymph node group, that we can successfully do things like surgery and radiation. I think many of those cases we do aim for a cure, and probably more than half of them we are successful with that. I think excitingly, there's a number of new, very potent immunotherapies that probably offer the promise of cure just in terms of the way these therapies work, and that is different from chemotherapy and the experience with other diseases. I think it remains to be seen what percentage of patients are cured for follicular lymphoma. But again, traditionally, we think it's something that a patient's going to have to be followed for the rest of their life, but not necessarily something that at any given time is going to cause major problems with their health. And many of these patients can live a very long and happy and productive life with follicular lymphoma.
It depends on the overall stage. In some cases, if you have advanced follicular lymphoma, it's not considered a curable disease, but it can still be very treatable. So even though the disease doesn't go away completely, many patients can live for decades with follicular lymphoma after treatment. In the early stage setting, if it's what we call a stage 1 or stage 2, if it's all in one area, we do consider those lymphomas potentially treatable, but we would incorporate different types of treatment. For example, sometimes we incorporate radiation for that treatment to try and cure the disease.